Welcome to the Home Healthcare Today Show. I'm your host, Dr. Cleamon Moorer.
Making every promise complete.
Today's topic is very important. It's all about Sexual Assault Awareness and Prevention Month. Over 45% of women and nearly 17% of men in the United States have experienced some form of contact sexual violence in their lifetime. Every 68 seconds, another American is sexually assaulted, and roughly two-thirds of those assaults are never reported. Today's guest, Dr. Tara Kane, is the Dean of Health and Human Services at Schoolcraft College. Dr. Kane has spent 17 years in law enforcement as a detective sergeant with the West Bloomfield Police Department. For over a decade, she served as a certified trainer for MCOS, which is the Michigan Commission on Law Enforcement Standards, teaching trauma-informed best practices for investigating intimate partner violence and sexual assault. Today, she leads from a different seat as Dean of Health and Human Services at Schoolcraft College, where she oversees programs that prepare the next generation of nurses, first responders, and public safety professionals. She believes in the power of education to change lives and in helping others realize their unleashed potential through honest contribution. Dr. Kane, welcome to the Home Healthcare Today Show.
Thank you so much for having me.
Dr. Kane, so let's take on this topic in discussion from the public health crises that it truly is. You've spent decades on both sides of the issue as a law enforcement investigator responding to sexual violence, and now as a higher education leader focused on prevention and professional training. How has your understanding of this issue evolved over the course of your career?
That's a big question.
Yes.
Yeah. So first of all, I think when you're new as a public safety professional, you just don't know what you don't know until you experience it. And I have a memory of responding to a domestic violence call where a victim shared that her husband had choked her, which we actually refer to as strangulation. Choking is accidental, strangulation is an overt act.
Yes.
But I didn't see any bruising, and so therefore I wasn't sure. And I've since learned that the majority of injury that one would find in strangulation is actually internal. So that's just one example of what I didn't know. But something else that I learned along the way is that reporting these crimes in particular to the police are scary.
Yeah.
And it wasn't until I transitioned to higher ed and I shared my experience and my passion for helping victims of intimate partner violence that more people, students, staff, fellow faculty, actually disclosed their stories or stories of their loved ones. And I knew that the problem was prevalent, but I had no idea to this extent.
Absolutely. Thanks, Dr. Kane. So, the CDC, Center for Disease Control, has identified sexual assault as a public health crisis. What changes when we begin to look at it from that lens as opposed to just being a criminal justice issue per se?
Well, the crime itself is horrible,
Yes.
but it doesn't just stop there for the victim, especially when a disclosure doesn't happen and someone carries the weight of this victimization and they never get help. So therefore, it can impact a relationship. It can impact one's ability to earn a living and be successful in just getting to work. It can impact relationships with family members, parenting. So it is something similar to what we see with folks who suffer with addiction issues. Good people, but they have these demons that they're battling that affect them personally and professionally. And it's the same with survivors of sexual violence.
Absolutely. So, this is, of course, the Home Healthcare Today Show. We go into communities and we understand that there's a lot of folks, whether they're family members, friends, etc., that coordinate, throughout a person's daily life. As we think about the public health issue, we understand that the data suggests that most of the perpetrators of sexual assault crimes are someone that knows the victim directly, a coworker, a quote unquote friend, a family member, an associate. How does the closeness, if you will, how does that impact the investigation per se, as well as the path to healing for the victim?
It's so complicated. First of all, the vast majority of sexual assault crimes
Yeah.
are perpetrated by someone a victim knows.
Yes.
The narrative that we see in movies and on TV is that it's the stranger jumping out of the van in the parking lot, abducting someone, dragging them into the woods.
Yeah.
Do those crimes happen? Sure. But the
Yeah.
prevalence, and it's more
Yeah.
likely that it's approximately at least 80% of victims know their perpetrator. There is the betrayal factor.
Yep.
There is the fear. There's the fear of not being believed. There's the fear of being re-victimized.
Right.
There is the guilt. Did I do something to
Sure.
cause this to happen?
Sure.
How did I allow this to happen? There's anger, and there's also self-blame. So
Yeah.
there are so many factors that go into this, and it's that much more complicated, especially when a victim knows the perpetrator. They're worried
Yes.
about not being believed, and therefore they're worried about not being believed by society and even folks in their network.
Yeah, I got it. So that person that's trying to mitigate all of those barriers, right, to reporting it, telling their story, it leads me to my next question about trauma.
Mhm.
So trauma informed investigation, right? Person that's really impacted by that. And a first responder, how does the first responder like cope or help the survivor or the victim cope in forming and leading that investigation that's trauma informed?
Right. So, I mean, I will certainly date myself when
Yeah.
I say, just the facts, ma'am, right?
Yep.
Adam 12,
Sure,
back in the
sure.
day when I was
Yep.
a little kid watching that police show with my dad,
Yep.
who was also a police officer. And we still teach recruits in the police academy the importance of, who, what, where, when, why.
Yeah. Yeah.
But when it comes to these crimes, we have to really focus on the victim. We need to be victim centered. What does the victim need?
Yes.
And offender focused. Who's our offender? Let's focus on the offender's actions versus what the victim did.
Yes.
Because when we focus on what the victim did, if we make them believe in any way, shape, or form they somehow precipitated this event, that's victim blaming.
True.
And they're going to shut down.
Yes.
So there is so much trauma
Yeah.
that one deals with when they survive an event like this that, again, it's so important to be victim centered.
Yes.
What do they need to get them on that path to healing?
Yes.
And maybe a criminal justice response isn't their priority.
Right.
It may be medical attention, safety,
Yes.
just getting them to safety, taking care of their children,
Yep.
versus I want this person arrested. And if someone's not hysterical and, calling 911, then there is the attitude of, did it really happen?
I get it. Dr. Kane, I think about public health and I also think about the home health audience out there and even seniors and elder abuse, where we understand that homebound individuals or individuals that are at the most vulnerable state in their trajectory, they aren't immune to sexual assault. Now, when you add trauma to one's cognitive ability to recall linearly or give a timeline for how certain things have occurred, that's challenging. How do you go about training, investigators, to understand that trauma affects how the brain works, and then there's some cognitive decline to an extent in some of the older populations?
Yes. So
Yeah.
I'm so proud that in 2010, the Victim Services Department in Lansing for DHS said, we are going to start this trauma informed training. We want to train advocates, police officers, prosecutors, how to do trauma informed investigations. Because what happens is this: it is counterintuitive the way we try to detect deception with a victim of sexual assault. Because as you already said, they're not going to have a linear memory.
True.
They're not probably going to disclose right away. For all the things I talked about, the self-blame, the guilt, the terror, the fear, they may not disclose for days, months,
Yes.
years. but that doesn't mean it didn't happen.
True.
And then most of that trauma and the memory, the way it's encoded in the brain, and there's a lot of research behind this. I mean, I would urge anyone to look up, neurobiology of trauma related to sexual assault. And even here, Michigan State is like the leader in this, the research that's been done. Memories are not encoded, as you said, in a linear manner. And so things can trigger it too. It can be sight, it can be smell, it can all of a sudden seeing a perpetrator. What if it's a family member? What if it's a coworker that someone hasn't seen in a while, and then they see them and then everything comes back?
Absolutely.
So there's a lot to it, and it goes against the way we investigate many other crimes. So that's why this trauma-informed training that MCOLS with DHS and Victim Services has been doing since 2010 is so important, and they continue to do it, and it's free. We're trying to educate as many law enforcement officers and prosecutors as possible.
Okay. This is helpful. It's helpful, and it gives us hope. We understand that it's a huge system out there, and folks call, their emergency department, 911. People go to emergency rooms, but we understand that in some cases systems fail. And when systems fail, survivors are sometimes blamed to that extent, dismissed, or re-traumatized through the sharing of their story. What's that ripple effect, Dr. Kane? What does it look like? And how does that institutional harm affect not just the individual, but sometimes the future reporting of individuals in a community?
Well, I'm sure anytime someone's been dismissed, they don't want to talk to that person probably ever again.
No.
And so the second a victim doesn't feel believed, particularly by law enforcement, how likely are they to report if it happens again?
Unlikely.
And that is so incredibly sad, because there is a reality that a victim very well may be re-victimized again, either by the same perpetrator or by another one. There is a certain vulnerability that perpetrators, unfortunately, can seek out and see in very vulnerable populations. The elderly, the mentally ill, the homeless, our incarcerated population. The least likely to appear credible are our most vulnerable folks, because perpetrators are counting on society and law enforcement to not believe the victims. And so therefore, that's where this circle of trust is broken, and it's why this crime is so prevalent, and it's why many perpetrators get away with this crime.
Wow, Dr. Kane, this is heavy. On the other, we're headed to a commercial. On the other side of the commercial, we're going to talk about prevention, how prevention is multifold through education, culture, and the path forward. Prior to the commercial, folks, there may be someone out there that is struggling right now, or currently a victim or being victimized. We always identify and suggest calling 911 in the event that you are being assaulted. In addition to the emergency situation of 911 current, the National Sexual Assault Hotline number is 1-800-656-4673. Headed to a commercial. We'll be right back. Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. Welcome back to the Home Healthcare Today show. The topic is very important. We are talking about sexual assault awareness and prevention this month. Our special guest, Dr. Tara Kane. Tara, we had a very interesting conversation in the first half, kind of dove into some of those challenges as related to victims / survivors of sexual assault. We talked about the system. To an extent, we even dove into trauma-informed investigations. Now, in the second half of our conversation, let's really talk about your role as Dean of Health and Human Services at Schoolcraft College. leading programs in nursing and public safety, as well as fire and the police academies. How does higher education play a role in preventing sexual violence, not just on the campus, but in the communities near and dear to us?
Well, I think it's really important that we take the education that we have, that we're providing, and we are having conversations right in the classrooms around dispelling myths,
Yep.
right? It starts with us. And on top of that, educating
Yeah.
particularly our police, EMS, fire, nurse professionals about what they may encounter on the jobs.
Yes.
And again, exposing them at least to the basics about how these victims are going to present
Yes.
and how we can support them.
Got it. Primary prevention, then. Okay, so let's go there. Primary prevention sort of takes on the tone or the connotation that I can work diligently to try to avoid or prevent certain situations that may lead, quote unquote, to sexual assault. But we understand that our young people out there can't, quote unquote, live in a bubble. There's going to be some dating, there's going to be some online interaction and conversations to an extent. What are some best practices as we think about it from parental standpoint, from an uncle standpoint, from an aunt, mom standpoint? How can we be more preventative in our approaches?
Wow, that's a great question.
Yeah.
Particularly for our young folks, I think it's really important as they start branching out and when they are out, right?
Yeah.
They have a great time, but they're safe, right? Like making good choices, being with friends,
Yep.
and making sure that friends are paying attention to what's going on as well.
Mhm.
I think that's where young people sometimes get in trouble when they get away from that friend group, when they end up isolated, and that's what a
True.
predator loves
Yeah.
is to, take advantage of a situation,
Mhm.
right?
Yeah.
And also start by believing. I think parents and their children having really honest conversations about healthy sexuality,
True.
our own bodies being our own bodies, as well as it's okay
Yeah.
to want to dress up. It's
True.
okay to want to go out and have a great time.
Yes.
There is a difference between going out and looking great and feeling sexy and all the things and being objectified.
Sure.
And I think that piece is something that as a society we still have a lot of work to do.
Long way to
We
go. Sure.
objectify women in particular, as well as young women.
Mhm.
And certainly social media,
Yep.
the internet, all that does not help.
I think about the socialization of certain drugs, like party drugs,
Mhm.
and the popularity of them, right? So we hear still a lot about ecstasy as a drug, right? We hear about Mali, right? And there's so many new forms of drugs and ways that folks of all ages perhaps get intoxicated.
Mhm.
What impact do or does the social environment and the quote unquote fun drugs have on sexual assault?
Well, again,
Yeah.
don't think for 1 second that a perpetrator isn't going to utilize alcohol and drugs to facilitate
Yeah.
probably an assault.
Yes.
And
Yeah.
again, when someone is intoxicated, they will lack credibility when disclosing. They may not even remember initially,
True.
or to others, they may look like they've gone along with the scenario when in fact they have not. This is where we've seen the infamous cases where there have been recordings, or for the fact that there were recordings,
True.
some perpetrators have been held accountable when they didn't realize there were.
Yeah.
When someone cannot walk and yet they're being drugged down a hallway into a
Absolutely.
bedroom,
Yep.
an apartment, what have you. But again, it's those conversations with friends
Yeah.
ahead of time are so important.
True.
Don't leave me. Watch out for me. Pay attention to what's going on.
Yep.
I have a son at Michigan State. Believe me, I know things happen,
Yes.
but it's always in the back of my mind, please make good
Yeah.
choices
Absolutely.
and be with your friends and
Yep.
have friends who are going to make good choices on your behalf when you can't.
That part, Dr. Keynes, and that's the setup for my next question about bystanders. Research suggests that bystanders are great tools, as well as ambassadors of defending a victim, right, or intervening. How do we do it safely So I have community health workers out there in the public health space that may see things going on.
Mhm.
And then, of course, on college campuses, we have, students that are in dorms, in some cases co-ed dorms, and there's off-campus housing and the like. How do you intervene safely?
Well, we never want a bystander who wants to help to get hurt.
True.
Therefore, distraction is always the better approach
Yeah.
than the confrontation.
Okay.
And that is something that I believe RAs, are taught, and they try to train others, especially in the whole college campus housing world. But again, it's paying attention. And here's the bottom line: right is right and wrong is wrong.
All day, every day.
And
Yep.
when you see something wrong and you know what is probably going to happen or potentially is going to happen, I urge all young people, middle-aged people, whomever, colleagues of maybe another professional in a home healthcare setting,
True.
in a residential
Yeah.
facility, to do something. And again, maybe not be confrontational if that's not safe for that person, but there are certainly ways to distract,
Yeah.
to divert,
Absolutely.
and potentially stop something from happening.
There we go. There we go. And I think systemically, to your point about like objectification, oftentimes, of young ladies, of their anatomy, the judgment as related to clothing and outwardly appearance, etc. So we got some systemic challenges and issues as we think about this, Dr. Kane. How do we start unpacking at different levels where we understand that, college and university may be its own separate environment to an extent, but we do the public health training of professionals that go out into communities. We got nursing homes and adult living facilities and foster facilities. How do we take a systemic approach that sort of looks at policy as well as practice and just the day-to-day realities that there are some bad people out there that have some bad intentions?
Well, I think we have to be honest about the fact that you're absolutely right. There's bad people out there, and
Yeah.
they need to be called out.
Real talk.
When I was a new police officer and I was a new detective in the early 2000s, it was not uncommon for me to hear a male detective in my area use terminology like regret sex, minimizing
Yep.
what had been reported.
Right, right.
But I'm going to be
Yeah.
honest
Yeah.
and share that, did I stand up to this person? No. And hindsight is always 20/20.
Sure.
But I so wish I could go back in time and say, "Excuse me,
Yep.
have you interviewed this person? Do you know any facts of this case? You've already decided this person's not being honest or they're making something up. Stop it."
True. Yep.
Your job is to start by believing. And I think that there's a lot of work around courage that has been done by some really great professionals, and for males to have the courage to stand up to other males to say, "No, this is wrong." No means no. No does not mean yes.
Right. Yeah.
And that has been a chant on some college campuses.
Yeah. And Dr. Kane, don't feel bad about that earlier experience in your career, because there's a power dynamic that's often associated to sexual violence.
Yes.
Right? So there's that power dynamic of supervisor to subordinate to elderly or older individual, parent-like figure, friend of the family to victim. So don't feel bad at all about that. And I think in the societal context of quote unquote boys will be boys, we have to do an about face to say humans should be humans.
Yes.
Right?
Yes.
And we have to intervene and certainly stand in the gap and understand, even with a power dynamic, it does not justify or it should not set the tone for taking advantage of
And can
someone
I
else.
just provide
Yeah.
one more example?
Sure.
So if a victim were to report that they were at an ATM at 11 o'clock at night and they were robbed, we may think, wow, okay, it was dark.
Yeah.
Was that really safe? But I doubt we're going to have a lens of, did it really happen?
Sure.
But yet, this is the one crime, sexual violence, regardless if it's a child, if it is a middle-aged person, if it's a dating relationship, if it's an elderly person. Unfortunately, the credibility of the disclosure in the first place is typically a part of the fact finding in the very beginning. And most crimes, we don't do that, but we do it with this one. And we need to stop.
We do. We need to stop it. You're absolutely right. Dr. Kane, someone might be watching right now that may not have been believed or may feel as though that they would not be believed, right? So there are some survivors watching right now. What do you want them to know? And for the family and friends trying to support someone, what's the most important thing they can do?
Wow. Okay.
Yeah,
So I
yeah.
will say this
Mm,
for the last 15, 16 years, we, and I say we, I mean the professionals in law enforcement and advocacy have been working so hard to train up our investigators to do better investigations, to do better by survivors. I think it's important for people to know that just because one does not want someone held accountable in the legal system doesn't mean it didn't happen.
true.
Just because a victim says, I no longer want to participate in prosecution, it does not mean they were lying or they made it up.
Right.
And I think we all need to start from a lens of believing,
Yes.
okay?
Mm-hmm.
Start by believing. And then on top of that, trauma is messy and it's not orderly. And by the grace of God, hopefully a friend, a family member will never truly understand what their loved one has gone through, but just be there for them because they're, believe me, no one has blamed themselves more than a victim
The victim.
of sexual assault.
You got it.
And they don't need to be blamed or judged or questioned by anyone else. They just need to be supported.
There you go. There you go. Dr. Kane, last question. Take us home. In 25 years of Sexual Assault Awareness Month, right? We've made some strides, right? And we talked about some of those strides on our episode today, but the numbers still remain stubbornly high. What gives you hope that we're going to be able to tackle this public health crisis in our lifetime?
I think of the Mothers Against Drunk Driving movement.
Yep.
Years ago, it was socially acceptable to get behind the wheel intoxicated and not get arrested. That is no longer the case. If you are a drunk driver, I don't care who your loved one is, your family, your friend are, they're going to say, what is wrong with you? Why didn't you call an Uber? Why didn't you call me? And I believe in my heart, someday we're going to get there where someone is going to be responsible for sexual assault. And it will be, there'll be no doubt that they committed this crime. And we will stop blaming the victim and we will say instead, how dare you?
Amen to that. Hey, well, that gives us a lot of hope as we close out this episode of the Home Healthcare Today show. Hey, everyone, stay tuned, stay vigilant, speak up. If you see something, you know something that's going on in terms of sexual assault, be an advocate. Stand in that gap for someone. Folks, stay tuned for next week's episode of the Home Healthcare Today show. We're going to dive into Foster Care Month. All right, you won't want to miss it. We'll see you then.